Okay, I'm going to go ahead and start right with question 12 for exam 5. Couple of different things here. I just want to talk about coding, sequencing. On this one, whenever you are coding a mother's chart, a baby's chart, remember a mother's chart has to have the O code, never a P code. Baby's chart, never a O code, only P code. Now this one here, you always want to start off with the O code and then the anemia, and then we have the procedure code. Okay, so this one here, we are doing codes for twin number 1. They are both transferred. So our first code here is going to be the Z38.30, and that's the twin live-born infant delivered vaginally. Okay, that again needs to be the first code. Remember that Z code is first for babies, and then we have the PO 7.03. Takes a little bit for it to catch up. Okay, so with that, that is going to be the low birth weight, which we have stated here. And then the other one is the 38, and that's preterm newborn, 30 weeks completed, 35, sorry. Okay, so here, keep in mind this was a student's last year exam. With this, you need to have the O code first. You never want that Z code first for how many weeks. So we have the O code first, and that was 023.42, unspecified urinary tract infection. And then we have the actual urinary tract infection, which is the B code, and then the weeks. It's very important, once again, on sequencing. As you can see, this student was sequencing the weeks first. So, of course, there were inconsistencies and the student got things incorrect. Okay, so this one here, we're going to start off with twin pregnancy, unspecified, number of placenta, unspecified number of amniotic sacs, 3rd trimester. Okay, so then we have our different Z codes. This patient here, full term, so we're going to go with 40 weeks. We have Z37.2, which is twins, live born, which we always need, and then our procedure code. Okay, so this one here we're going to start off with, they were admitted for sterilization. Whenever anybody is admitted for sterilization, that code has to be first. So we have the Z30.2, and we have N80.0, endometriosis of uterus, and then our procedure code. Okay, so this one here, delivery term, birth, living child, ROA presentation, 39 weeks. And this is a normal birth. Whenever you have the normal birth, you can use the 080. We have, once again, live born, and then we have 39 weeks code. Okay, let's look at the next one here. This one here should be 064.9XX0. One mistake that this student made, you never have an 080 with another O code. Okay, so my 064.9, go ahead and pull that up. Oh, 064.9, obstructive labor due to malposition. Okay, and then if I click on that code, we go to what fetus, gives us the breakdown. And with that, we're going to go with the XXO because it's, again, unspecified. And then we have the 032, .2, okay, maternal care for transverse. Okay, and then we have 011.3, that's pre-existing hypertension. And then once again, we have weeks, live-born baby, single live-born. Our Z codes are last. Okay, so now we get into the abortion topic area. These were pretty good. This one here, we're going to have this spontaneous abortion with a retained placenta. This one here, with a live-born. So whenever you have live-born, you code these two codes here, the Z37.0, therapeutic abortion with electrolyte imbalance. Go ahead and look at that one here. Okay, so with that, it's taking a little bit to catch up. All right. Termination of pregnancy, unspecified. Okay, so here again, we have an elective abortion because of a chromosome abnormality of the fetus. So we have the Z33.2. And then we go to the 035, which is maternal care for suspected chromosome abnormality in the fetus. Okay, we have a missed abortion. Okay, so then let's go down to the babies. So remember, with the babies, we want to start off with the Z38.00. And when you do that, that's always the principal diagnosis. Okay, single live-born infant. And then, if it was twins, then it's going to change. And then it's all your P codes. All right. One thing to remember, you do not put any O codes on those. And we have the Z38 again, 00, P11 for the facial paralysis. And we move down, and these were pretty good amongst students. The biggest thing is to remember to use that Z38 code. And this code you do not utilize this code on the mother's chart. This one here, I pretty much, if you were close on it, I gave you points. This one again, I think this student here was just a digit off. Must have been a typo, but it should have been Z3830. Okay, with these, you're going to use a lot of the Q codes and your procedure codes. You can see Down syndrome, a Q code, stenosis, congenital. So with anything in this area, it should have been the Q codes along with your procedure. And actually, everyone did pretty good on that section. So if there's any questions on sequencing or anything for this area, please let me know.